Naushad Saab, thank you for inviting me and having me on your show.
Thank you very much.
Thanks, sir, for sharing your perspective.
Thank you. Thank you.
Thank you, sir. Thank you. A pleasure to have you in our show.
Naushad, thank you for inviting me for this conversation.
Thank you.
Welcome, sir, to our next episode of Expert Insight.
Thank you very much indeed.
Hello, good evening, and a very warm welcome. For our next face-to-face, I have with me our guest, Professor Ranjit Singh Ghuman. He is currently Professor of Eminence at Guru Nanak Dev University, Amritsar, and member of Supreme Court constituted High-Powered Committee on Agrarian Reforms. Earlier, he has been Nehru Chair Professor at CRRID Chandigarh, Professor and Head Economics Department, and Dean College Development Council at Punjab University, Patiala. Besides, he was the special invitee member of 6th Finance Commission of Punjab and Chairman MSP Committee at Punjab Government. Professor Ghuman has authored and edited 16 books and published more than 125 research papers in reputed professional journals, and has also edited books besides guiding 12 PhD and 25 MPhil scholars. Dynamic of Drug Addiction and Abuse in India is his latest book, published by Routledge UK in 2024. In addition to teaching and research, he is a prolific writer in English and vernacular dailies on co-cultural, political, economic issues, beside participating in panel discussion on electronic media. Welcome, sir, to our next episode of Expert Insights.
Thank you, Mr. Khan. Thank you.
Sir, just for our viewers, can you please tell us about your research and share some key findings from your research on drug addiction in Punjab and what insights you have gathered from your research work?
Mr. Khan, actually, we started this study in 2017 when I was at the Center for Research in Rural and Industrial Development, Chandigarh. In fact, that study was sponsored and commissioned by the Indian Council of Social Science Research. And two other young scholars were with me, Dr. Gurinder Kaur and Dr. Jitinder Singh. We conducted this study for 5 states: Punjab, Haryana, Himachal, Rajasthan, J&K. In fact, the main focus was Punjab, and the field work was done in all the 5 states, 8 districts in Punjab and 2 districts each from other states. That was the sample, and we reached the addicts through the de-addiction centers and rehabilitation centers. And in all, we interviewed 1,140 addicts, and there are 950 households, then 616 control groups, 640 FCDs, case studies 40, and total sample was 3,386. Now, as regards the findings, I will confine myself to Punjab, since you are going to conduct, laid down this interview for Punjab only. I would like to say that there are many. Let me first tell that we did not include alcohol in our study. We only included those illicit drugs which have been declared illicit under NDPS Act 1985. So that's one. Second objective was, what are the social, political, and economic causes behind that? That was behind on our mind, that why the people, youth, get into drugs. Now, having said that, I would like to add that I would like to say that we visited 73 de-addiction centers across all the states.
Yeah.
And we studied types of households, nuclear families, then joint families, and most of them were nuclear families. And for us, age of drug addicts was very, very important, because I would like to say that in our study, 78% of the addicts were in the age group of 17 to 35. And you will appreciate that this is the most productive age cycle in anyone's life. And this is a very, very serious, has very serious implications for the individual, for the households, for the society, as well as for the country. So that is one main things which we connected. Then, as far as education level is concerned, uh, most of them were educated up to the senior secondary level. Some, of course, about 20% were either illiterate or up to primary, but most of them were educated up to senior secondary level. So if we talk of average income of the households, 80% of the households from of the drug addicts were up to 10 lakhs per annum. This was the income of the households. And age of drug addicts at the time of entering into drugs is again very important. And that is 67% of the addicts entered into drugs between the age of 14 to 20 years. So this again tells us very, very important indication that parents, society, the country must be very, very concerned about their children in this age. That is one lesson we get from it. And then, of course, growing up with the addicts, nearly 81% of the households uh, households were consuming alcohol. This doesn't mean that 81% of Punjab households. This means only of those addict households, 81% were consuming alcohol. Of course, we did not study alcohol. And again, intoxicants consumed was for the first time, but the alcohol and heroin, opium, cannabis, etc., etc. But and they transitioned from less harmful to more harmful and more frequency of the addicts. And nearly 80% of the addicts started with the harmful drugs between the age of 14 to 25. And then we studied 10 what are the main the drugs which are being used in Punjab. We identified 10 main drugs: heroin, opium, tramadol, poppy husk, cannabis, marijuana, buprenorphine, codeine, hashish, and cocaine. And you will be surprised to know that 65% of them were using chitta. So, another very important factor which came into, on an average, the every addict was consuming more than three drugs, not at a time, but over the period of time they were using. And of course, we you will be interested in sources of study, sources of supply. Both external and internal sources are there. Golden Crescent, that is Afghanistan, Pakistan, and Iran, is the external source as far as Punjab is concerned, not for the country as a whole. Then, of course, inside suppliers. And nearly 92% of the addicts take drugs from the peddlers. Now, here one may get confused that peddlers perhaps are the main source. Peddlers are at the front desk. The suppliers and smugglers are at the back. This needs to be, and this is the reason which why supply chain is not being dented. And there are multiple sources, methods of consumption are there. We studied oral, inhaling, injecting. All three methods they were using. And the most important factor for getting into the drugs was peer pressure. So, which means in this age, we must be careful about the children, about their peers and company and friends. That is very, very important. And then we also studied socio-economic cost. We may bring it into discussion later on, but that is also very important. And it dents the social image of the family, health of the addict, HIV/AIDS, and all that, and the mental or psychological impact and the work of the addicts and all that, and family image. And then there are adverse impact on addicts' family relations, which means trust deficiency, emotional distress, and violence in the family. That is also. And it's also important to know that average daily expenses range from on the dose range from rupees 200 to rupees 2000 up to rupees 5000 rather. Now then on de-addiction and rehabilitation, it ranges from 10,000 to 1 lakh, depending upon whether it's government de-addiction center or private de-addiction center. And then there are premature deaths is another concern. It's important to know that about 19% premature deaths in the age group of 15 to 20, 25% in the age group 25 to 30, and 37% in the age group of 20 to 25 years. This is again a very, very serious, has very serious repercussions for the society. And the last but not the least, we also studied community perception. What, through focus group discussions, what community or people think of the government, religious institutions, youth icons, police, elected leaders, state, and all that. And in one sentence, if we are to say, two very, very important findings came out. One, there is a nexus between police, smugglers, and political leaders. But here there is one catch. One should not. It's not across the board. When I say that police, smugglers, and politicians, not all police officials are officers. Not all politicians are political leaders. But across the political parties, they are. Second is that when political parties distribute intoxicants or drugs during the elections, it dents their moral authority to control the drugs. That is again, so this nexus is very, very important, and this probably needs to be broken and dented with a heavy hand. Ji.
So there are also media reports, and I have read from the media that very recently the DGP Punjab declared that a 3-month-long anti-drug campaign has achieved major success. But he also said that drug menace has not been completely eliminated, and asserted that crackdown will continue. Your response?
In fact, let me add that this was not the program of DGP alone.
Yeah.
Government, state government started this program, Yuddh Nasha Viruddh, from 1st of March 2025.
Yeah.
And deadline was 31st May. But now the deadline has been extended, as you rightly said. But this is appreciative effort of the state government, and the fields reports which we come to know, we have come to know is that deterrent is there, and supply side has been dented, but and demand is also curtailed. But the issue here is The question is, will it be sufficient to dent the supply as well as deal with the demand? I think the state must get into the reasons behind this. But just by giving ultimatum or setting targets, the menace cannot be addressed. And one more thing, the fundamental reasons behind the problem, which are social reasons, economic reasons, cultural, political, will have to be addressed. And until that done, probably this alone can partially and temporarily the dent the menace, but it will not be a sustaining long-term solution. Yeah.
Okay. What are some of the significant challenges in addressing the drug menace in Punjab and how they can be overcome?
This is, in fact, a very, very important question. As I said earlier, political police and smuggler nexus is one of the challenge,
Yeah.
and a constraint on political leadership and state machinery to curb that problem. Now, on the supply side, denting the supply chain and supply side is again a challenge, both external and internal. And I would like to add here that Government of India has extended the operation of central forces in Punjab, because 553-kilometer border, international border is there with Pakistan, and the smuggling through drones or other means enters into Punjab or in other parts of India. Now that is, I think, is a challenge. How to? But as Government of India has extended the operations of the central forces up to 50 kilometers depth from the border, I think this, in fact, puts a responsibility on the central forces that there should the smuggling from the neighboring country should not be allowed at all. I think this is again a challenge. On the internal sources, again, of course, when there is patronization or some other sport, that's the problem. And on the demand side, two issues are very, very challengeable issues. One is de-addiction and rehabilitation of the existing drug addicts. Second is curbing the new entry into drugs, both as consumers and suppliers. Now, these are the challenges, and these challenges can be addressed only by a by politico-bureaucratic social will against the drugs. And of course, these things will have to be and figured into the Yuddh Nasha Viruddh. That is the challenge, I think. Thank you.
What strategy would you like to propose to tackle drug menace in Punjab, and how can the government, law enforcement agencies, and communities work together to address this issue, including political party, social activists, civil society, and religious leaders?
Mr. Khan, I think this again strategy, before strategy, the government and the society will have to admit that the problem is there, and problem is there since long. Particularly since 2012, it has entered into political manifestos of each party, and since then it has been intensified uh, in the manifesto as we move from 2012 to 2022 elections and even 2024 parliamentary elections. Then, having admitted that, then two, three-pronged strategy will have to be there. Awareness, prevention, curbing, de-addiction, and rehabilitation. And second is, for sustainable solution to the problem, we will have to address the socio-cultural and politico-economic reasons behind drug addicts. In our study we have highlighted those reasons. Why it's when there is a public display of alcohol consumption or other things in social functions, I think this needs to be addressed. And the highlighting and the drug addiction, the intoxicants and guns in folklore or other through other medias, I think that needs to be covered. That should be strategy. And prerequisite for this is necessary condition: admit and diagnose. Until we diagnose properly, solution will not come to the satisfactory level. And the sufficient condition is that effective implementation of the policy with commitment on the politico bureaucratic, police and societal will, and multi-pronged and multi-dimensional measures will have to be taken. And we will have to admit that problem is systemic, and solution too will also be systemic. Now, first is that we are treating the addicts as culprits or criminals. They are victim of system, and they are not culprit or criminals. We must treat them, the addicts, as patients, not as victims or culprits. And how can all the stakeholders could work together? That is again a challenge.
You
I
mean
think,
to say that instead of criminalizing them, they should be rehabilitated?
yeah. First, we must admit that they are not the criminals. They are victims of of the systemic problems or distortions in the system. So then, having admitted that, we should treat them patients, and of course, their rehabilitation, not only de-addiction, rehabilitation, and relapsing is another serious problem. In our study, we found that more than 66% of the de-addicted again relapsed, and the major factor was that they were not having the commensurate compatible family atmosphere, social atmosphere, and of course social sport and family sport, and the peer pressure again, and the yearning for drugs again push them to the drugs again. So for this, the system must involve experts, civil society, educational institutions. Punjab government started Badi program and OOT program. And again, under OOT, the government is trying to taper off from the more harmful to less harmful. That is buprenorphine and all that, tramadol, like that. But again, we must be cautious about that the drug may not be the add long-term dependency on the buprenorphine and all that. And we must be careful of that. And there are some indications that those who are using buprenorphine since for a couple of years, they are now fully dependent on buprenorphine. That again is a problem and challenge. Yeah.
So, how important is interagency cooperation in combating drug trafficking, and what steps can be taken to enhance collaboration between different agencies? So, there has to be some mechanism of cooperation and coordination in order to deal with this menace effectively, so that it can be curbed accordingly.
There is no denying the fact that it's very, very important. Interagency and intergovernment, interstate, and center will have to enter into it. So that is very, very important. And they must share real-time data and information on drug smuggling, drug addiction, and all that, and best practices across the states, because this problem is not confined only to Punjab, not confined only to India, but it's global problem. And even the UN agencies have accepted it. So then establish regional drug councils. Here, I will like to draw your attention that this northwestern part of states of India, they organized two chief ministers conference on this drug menace. The second one was in 2019 in Chandigarh, where 8 states participated, and it was admitted and highlighted that this menace is not easy to be tackled because huge money is involved in it,
Yeah.
and that huge money and patronization, I think such conferences should be held more frequently, and we must establish regional drug councils, enhance intra and interagency trust and cooperation. Until that is there, just by nagging one party or the other, I think all the political parties, all the states, including central government, must admit that it is a national problem and should be dealt with in a missionary mode. Ji.
So, is there any model in around the world where the drug menace has been tackled very effectively, and what, if there is any, what Punjab or elsewhere where the problem persists can learn from that model? Is there any model available where it has been dealt with effectively?
I think there are even in the developed country, most of the drugs, heroin particularly, it travels to where the purchasing power is there. European Union countries are there, Western countries are there, America, Canada is there. Canada has done taken some measures. They have opened some less harmful drugs to the drug addicts and all that. But so far, I do not have any idea whether they have been able to address the problem on the sustainable basis. Yet results are to come, and of course, efforts are being made here and there. But most important is awareness, control, and rehabilitation, and of course, addressing and the problem of new entry also is very, very important. And still, I think most of the nations where drug problems there, or states where drug problems there, are just grappling with the issues. Yeah.
Okay. What role can education and awareness, you have already talked about education and awareness, play in preventing drug addiction, and how can we promote a drug-free culture in Punjab? Is it possible? Can we think of?
It is possible. I'm not pessimist, I'm optimist.
Yeah.
The only precondition is that society, government, political parties, and the stakeholders must muster courage and willpower. That is there. Second is, it is possible when we identify the reasons. Of course, we have given the reasons. This is our book, which came in 2024. And I think the government will take a cue, and we can say this is the first of its kind because other studies have not went into the digging of the reasons behind the drug addiction and all that. Now, as far as educational institutions' role is concerned, it's very important. Two places are very important for a person, particularly in the formative years. One is home, the other is school. School teachers and home and the surveillance agencies must be there around the schools, particularly because uh, they, the demand is generated and enabling environment is being created by the suppliers to attract gullible youth into the drugs, and that I think is important, which needs to be tackled. Now, educational institutions, particularly colleges and universities, they can play a formidable role in by educating by way of the plays, nucleotics, and all that, and proactive role. And government must rope in. And I would like to share that Punjabi University Patiala has contributed a lot in this respect in terms of buddy programs and other programs. But and its speech and drama department sometimes back. Prepared many small dramas on it, and it has got a direct impact on the viewers and all that. So I think the educational institutions can play a very important role. As far as promoting drug-free culture in Punjab, I think this is the biggest challenge, because in every society and culture, this drug use, addiction, I don't say addiction, but drug use is there. And because addiction, and there is difference between use and addiction, and use and abuse. Or now, this would have to be long term, and there must be a clear time bound roadmap with short run, medium run, and long run uh, uh, issues and goals, marks and goals, landmarks and goals. Now, as I said earlier, the problem is systemic, and the solution will come from the system. Another thing which we must admit, that 100% drug-free culture is just not possible in any society ever since the civilization on the Earth planet. But efforts must be made, and with efforts we can reduce the use and abuse, particularly abuse to a large extent. And as far as use is concerned, that too can be reduced by addressing, by awareness campaigns, and by addressing the causes behind the use and abuse. And this can be done only if efforts are made in a sincere manner. Supply chain and demand side will have to be addressed. Otherwise, if we are to address only with short-term measures, short-term results will be there. But long-term sustainable results can be there only if we have a sustainable long-term goal to address the drug menace.
As we are running out of time, can you please briefly tell about how would you like to evaluate the effectiveness of current initiative to combat drug trafficking in Punjab, and what areas need further improvement? In brief.
So the problem is deep-rooted, as I said earlier. So it is not that simple as is being understood by the government of Punjab or by other governments. Uh, had it been so simple, it would have been addressed, since many SITs and STFs were formulated, and they have given reports. They tried their level best, but it could not bring the desirable results. So this problem, Yuddha Nasham Virudh, to make act as deterrent, may slow down supply chain and temporarily put a conjunction on the demand side also. But effectively, if we are to address it, for that, government and all other stakeholders must join hands and heads to start Yuddha, not Nasha Virudh, but against the fundamental socio-cultural and politico-economic reasons. We will have to start Yuddha against those reasons, and we will have to address those reasons, so that the new entry is addressed, issue of new entry is addressed, and we have some sustainable solution to the problem. Until and unless those reasons are addressed, this problem will continue. Entry will be there, and this will go on and on and on. I think that is the biggest challenge, and effectiveness will come only if address the issues. Otherwise, just for temporary addressing the problem and giving more and more loud slogans probably will not get bring in the desired results. We'll have to have a holistic policy, and we'll have to implement with all sincerity and effectively, and in a long-term mode, in a missionary mode. Otherwise, I think the problem is not that simple, that we will address this problem just by Yuddha Nasha Virodh, but Yuddha against the fundamental reasons behind the drug menace and drug use and abuse. Thank you.
Okay, sir. Thanks for sharing your perspective. We'll be back next time with another expert. Thanks for watching. Take care. Keep your environment clean. Goodbye.
Goodbye. Thank you.
Thanks, sir.